excuse me for this delay. Really, since this surgery done by Dr. Khalid Bradley, from that time till now, we are every day expressing more and more advancement in cataract surgery and advancement in the IOL implantation and the IOL calculation. Really, this surgery, it was the first thing that we, from that time, where the patient, after that, he discovered to have a 21 diopter, minus 21 diopter after this implantation of this IOL. Since that time, really, we have to have more and more advancement. My lecture today is about special cases of IOL calculation in patients, like patients after refractive surgery or patients after vitrectomy surgery, or even, as Dr. Ahmed says, about patients have an ectasia. One of the my patient, you see that I have patient, he had myopia, and she didn't tell me that she had a previous surgery or LASIK surgery or PRK surgery. That's why I do for her cataract surgery. She had cataract, and I do for her cataract surgery, and surprisingly, I see that after the surgery that she had +2 diopter hypermetropia. This hyperopic surprise is very, very common if you do not calculate the IOL very perfectly after a case of LASIK or refractive surgery. What's the patient had? Patient satisfaction. So my lecture is about satisfaction of the patient. Is this patient will be satisfied? Of course not. Patient changed from myopic to hypermetropic. He now needs glasses for near and glasses for far. So he's very, very unsatisfied. So what we should do when patient with post-refractive surgery for IOL calculation. For IOL calculation, there is a lot of theories, and I don't want to go in it, but I want to tell you that there is a lot of ways and a lot of method for detecting how much we should put as an IOL. But the most important thing is that those patients after refractive surgery, really they are very demanding. They are not accepting to put glasses after the surgery. So very, very important for you when you decide to do for them surgery is to try to make them without glasses, at least for far. So those patients like this patient, because you have history, I go to the practical point. Here in the Hagiz and Parrot formula, we have something here is called treatment mode, يعني LVC يعني laser vision correction mode. This is every patient that I nowadays put for them. Like this patient had myopia, and by his history, and I know that he had previous eyeglasses, so I put this eyeglasses in this formula, and the only formula that give you this treatment mode is Hagiz and Parrot formula, really. And you can see that after the surgery, he had no more any refractive error. This is not the only case. I have a lot of cases. That's why I am just bringing one example for each one of these examples. This patient also, she had very severe myopia in one eye with very severe astigmatism, and you can see that this is a patient of keratoconus. This patient with keratoconus, as Dr. Ahmed said, that we should measure and how much, of course, we do for her cross-linking, and after a very long period of become stable. At that time, here I want to give you the trick about how to do the IOL measurement. Don't depend on the measurement of the IOL master. Don't depend about the measurement of the autorefractometer, keratorefractometer. The best is to do for the patient pentacam, because by the pentacam you can measure only the central 1.5 millimeter from the center of the cornea, not all the 3 millimeter as others do. So this 1.5 millimeter you can see that the K reading is much different between the K reading of the IOL master, which is here 51 and 57, while the K reading in the pentacam is 51 and 52. This is make a lot of, because this astigmatism is not a real astigmatism, like the astigmatism in patients with pterygium. Those patients not with pterygium, usually they have astigmatism which is not affecting their vision because it's peripheral in origin, not in the central part of the cornea. So what our concern is in the center of the cornea. After implantation of the IOL, if you see that without in the previous, if you see that in the previous measurement, that the patient measurement, it was 1 diopter for implantation, while in the measurement the same happen again. Please here, Jamaat. What's happened? So that's why really they told me about the time, because we really have a lot of other cases. This is when we measure it again by the different type, by the different K readings. We can see that it's become 4.5. After implantation of the IOL, we implant for her and aiming myopia. We get really a good spherical control, while the cylinder is still high, but of course the patient doing better, and with the glasses it can be controlled. And other cases are I want to give you just the summary of another case with this patient with history of cross-linking, and after the cross-linking, history of LASIK, and then she developed ectasia. After the ectasia, I do for her cross-linking. After the cross-linking by a few weeks, because you know that after the cross-linking, the patients usually become worse for a few time. So she go to fit a contact lenses in another center. She comes to me with keratitis. After the treatment of keratitis with cross-linking, she start to have a flattening of the cornea, and this flattening of the cornea with the corneal haze, it was amazing, and she start to have no more any astigmatism. So she just have a +3 diopter sphere, and here she also had a cataract and the hazy cornea. I didn't think that it will be improved after the cataract surgery so much. So I did for her cataract surgery, and you can see that this is approximately 7 or 8 months after the cataract surgery. She's seen 6.9 without glasses. The result was amazing, and this is approximately one year after the surgery. Her vision is now 0.8. Another case, and I will stop with this case because this is the time. This is a patient after vitrectomy. Patient had previous keratoconus, previous refractive surgery, and she had previous LASIK. And when she came to me, she had a retinal detachment, upper retinal detachment. Her vision was very, very poor, 0.2. And I sent her to the vitrectomist. Vitrectomist do for her vitrectomy surgery, and by the follow-up of all of it, she was having +4 after because of the silicone oil inside the eye. And after all these follow-up, we can go to the conclusion that we need to do for her cataract surgery with the silicone removal in the same day. But here the measurement, the problem is that we don't know how much she had myopia before. So what we put in this treatment mode, I tried to put -3, -4, -5, -7. I tried all these supposing that she was a myopic like that, and I don't know how many myopia. And I reached to the highest IOL I can reach it from all these degrees, and I choose it. So I choose to do for her this degree, but you can see also that the patient had a silicone inside the eye. So in this formula, you should put that you have a silicone. So if you look, after putting this, it was 15. After putting the silicone, it becomes 16. So I did for her cataract surgery. I put for her 16 diopter IOL, and the result was very, really amazing. And the patient had, after LASIK surgery, and then retinal detachment, and then vitrectomy, and with silicone, then silicone removal, and IOL implantation, and now she has 0.8 vision. And this is because really I am, this is not only the cases I know, I am I want to thank for Mr. Harold Bradley, and thanks for you, for all of you, for your attention. Thanks for Harold Bradley, and thanks for those persons who are working to improve our job. Really, thanks for SRK, and thanks for Professor Wolfgang Hagiz, for Graham Barrett. Thank you very much.